Support comes from the Missouri Forest Products Association, committed to conservation and careful management of the state's forests to make them more resilient and better habitats for wildlife. ChooseWood.com.
From St. Louis Public Radio. This is the Politically Speaking Hour on St. Louis on the Air. I'm Jason Rosenbaum. A new state report revealed a startling revelation about Missouri's child welfare system. Children's Division investigators tasked with looking into accusations of abuse and neglect failed to heed warning signs that parents were taking fentanyl before those parents' children died of accidental overdoses. This finding is raising sharp questions about the management of the Children's Division, an agency that's faced daunting challenges in retaining and recruiting people to look into child abuse accusations. And it's prompting calls for the legislature and the governor's office to change how these investigators are trained, overseen, and paid. Joining us now is one of the people who helped put this report together, Jessica Seitz. Seitz is the executive director of the Missouri Network Against Child Abuse. Jessica, welcome to the Politically Speaking Hour on St. Louis on the Air.
Thank you. I appreciate you having me here today.
This report stated that Children's Division investigators, quote, lacked essential procedures, missed warning signs, and left vulnerable children at risk. Can you provide me some specifics about how investigators missed warning signs that parents of children who died of fentanyl overdoses were taking fentanyl?
Sure. We did a comprehensive review of all the fentanyl-related fatalities on this committee.
In 2022,
In 2022, yes. All 2022 fentanyl-related fatalities of children. And yes, we found multiple cases where warning signs were missed that a child was still in danger at their home, and it led to a fatality. So we found there were cases, so specifically I'm going to talk about the cases when I'm referring to cases of the young children, but where there were clear drug problems including at birth, where mom or child tested positive at the hospital, and they were home, and then there was ongoing evidence that drug treatment, that there was no cooperation, the drug treatment was not successful, yet children remained in these unsafe situations.
I mean, I'm going to be very candid with you. These types of findings are stunning to me. And I spoke with Emily Van Schenkoff of the Missouri Children's Trust Fund and asked her point blank if she was shocked by what she found.
It was really hard to see. But I would say I have been working in child welfare for close to 15 years in the state of Missouri now. And so I understand a lot of the complexities about why these things happen in a different way than other people do. But yes, I would say there was a strong emotional reaction on my part to reading these cases and to seeing how they were investigated.
That was Emily Van Schenkoff with the Missouri Children's Trust Fund. Did these findings shock you as well?
Yes, my reaction mirrors Emily's. Both of us have been advocates on policies related to child abuse and neglect prevention and response, have reviewed alarming cases, but yet this group of cases was very alarming and shocking. I was shocked by the severity of these cases, and that led to the fatalities.
So the big question that I think all of us are asking who have read this report is, why do you think the investigators didn't immediately try and get a child out of a home if they had evidence that a parent was consuming fentanyl?
I think so. There were two things that happened, and we can go into more specific recommendations. I'm happy to go into all of them, but there was safety was not properly assessed, understood the level of danger that these children were in at their home. That could be due to lack of training and the lack of using safety assessments, risk assessments. So, and then that tools that do exist to support safety were not properly or not employed at all.
Yeah, I mean, I have learned a lot about how investigators react to child abuse claims in the last few months, and we'll get to this in a little bit. But if an investigator finds that a child is in imminent danger, they're supposed to call law enforcement, and they're supposed to react to that as if, like, they're supposed to react to that very quickly. But it doesn't seem like, at least in 2022, finding fentanyl or finding evidence of fentanyl use rose to that level of alarm. Is that what you found out as well?
Yes. I mean, I can reinforce over and over that Children's Division isn't the only party responsible for child safety in our state. Law enforcement, the juvenile office, which we'll discuss later, there are multiple disciplines of a multidisciplinary team responsible for investigating child abuse. But those parties have to be engaged and involved.
Well, let's talk about juvenile officers. Missouri has an unusual system where Children's Division investigators do not have the power to just take kids and put them into foster care. They have to gather evidence, present it to a juvenile officer, and they're employed by the courts, and then they get the process rolling to get a judge to order a removal. But it really seems like the communication between Children's Division and juvenile officers has been very fraught for a long time. Can you talk about that? Yes,
very fraught, and consequences of that were seen in these cases and in this report. Yes, Missouri has a unique system. In other states, their Children's Division or their Child Protective Services, whatever it may be called, has a direct link to the court. In Missouri, we have another party called the Juvenile Office that is our link to the court. So if you want court involvement or oversight, which are very important tools in holding families accountable for keeping kids safe, you do have to have that partnership and that communication to the juvenile office.
Well, there's another tool called temporary alternative placement agreements, and that's a formalized agreement where a child could be placed in a different home while a parent goes to, say, a drug treatment program. But from talking with you before, it doesn't seem like that tool has been utilized nearly enough, especially when it comes to fentanyl cases.
Absolutely. So there's a story to where TAPAs came from. Again, temporary alternative placement agreement. Long name, but it's very descriptive. The story is that, so concerns over safety not being properly assessed and is not new. And there was a task force on child safety that convened in 2019 that led to recommendations. Lawmakers responded to that and passed TAPAs. And what they are is they're voluntary. A child is not put into foster care and is not involved in the court system yet. A child is placed temporarily in the home of a relative, and then a notification, however, just to throw this out there, a notification to the juvenile office that a TOP has been put in place does happen. So the case, they're not formally involved, but they are notified. Because they are voluntary, if a family is not cooperative with the provisions of a TAPA, the court can be notified.
I was just going to ask that because it seems like that is a very well-meaning policy, but if parents are not willing to enter into it, or they say, I don't have a drug problem, and I'm not going to let you take my kid and give it to like my parents or an uncle, it falls apart.
Yes, a TAPA is only as good as it is in its development, the plans, the solutions, and the implementation, and the cooperation. It's a partnership between the Children's Division and a family. And if there's a lack of cooperation, then referral can and should be made to the court to discuss next steps.
We are talking with Jessica Seitz, the executive director of the Missouri Network Against Child Abuse, on this new report about child fentanyl deaths. So it's no secret that the Children's Division has had a lot of trouble retaining and recruiting investigators, especially in places like St. Louis, where there still is a pretty sizable backlog, though I think it has gone down. Do you think that part of the issue here is that investigators were so overworked and were so overwhelmed with cases that they just were not paying the proper attention to whether parents were taking fentanyl and the child needed to be removed from the home?
I think that's certainly part of it. Our Children's Division has just been overwhelmed, and they have an incredibly difficult job. And child welfare investigations are complicated. They're not easily solved with a conversation and an agreement where you leave. And they require, multiple conversations, interventions with a family, potentially others, that have contact with children. And it's hard to give that level of attention to detail when you have such a huge caseload.
I asked this because Children's Division Director Daryl Missy has openly said that the staffing troubles at his agency prompted investigators to prioritize accusations of abuse or neglect where a child is in imminent danger. Here's Missy talking with me last year about that topic.
So they're investigating abuse and neglect, and neglect is defined so broadly that you could drive a truck through it. So a lot of times those things come down to issues of poverty. But so you have allegations of physical and sexual abuse, which are our most serious things, and then you have neglect, which are most of the cases, and those are normally fueled by addiction, mental illness, and poverty. And so you have some triage going on, obviously, because you've got things that are crimes and are emergent. You put on the front burner. And then, the dirty house case, the educational neglect case, those things may take some more time because you're not thinking somebody's going to be harmed today because of that.
That is Children's Division Director Daryl Missy talking with me last year. I'm going to ask you point blank, do you think that this report showcases the consequences of the triaging that Missy was talking about?
Yes. I understand what the director was saying with that statement, especially in the conversation that you were having. But I believe the quote about neglect is a dangerous generalization of the term neglect. These cases that we reviewed were neglect cases. It is a fact. A majority of reports and cases in the Children's Division are neglect. Where we may not be on the same page and where I have concerns, definitely based on my work with this committee, is how and when neglect is being triaged. There are cases of neglect that are not abuse, where mental health or substance abuse are involved, that place children in imminent harm. We shouldn't put them aside.
I guess to play devil's advocate, if you are running an agency where you are so chronically understaffed, there's no way that you could say to me or anybody, yes, we're going to get on that neglect case immediately. So, what can be done to prevent this triage from happening? We're going to be talking about some of those solutions, but part of it is you have to hire more people. Mm-hmm. And I think that there has been some improvement in St. Louis, but I think the question is, if they're not well supported, are these people going to stay long term?
If they're not well supported, they're not going to stay. I think that we've already.
I think I answered my own question there, but continue.
Yes. I mean, I've said over and over, and that these cases are complicated, which again requires investigation, multiple points of conversation and meetings with families, which are best done if there's a consistent caseworker, right? If workers are retained. But they need to be supported. They're not simple, but in some of these cases, the assessment of safety and risk that wasn't done timely, could have been done immediately, and with the support of that workers, it's not just on the worker, that individual caseworker, with their support of their supervisor, which is required. A 72-hour consultation with your supervisor to discuss risk is supposed to happen.
Yeah, and let's talk about solutions. And accountability was one of the things I wanted to talk about. I have a lot of sympathy for these investigators. As we'll get to in a minute, they're overworked. They are ridiculously underpaid. And they encounter some of the worst situations that a person can encounter. But I just have to say, if they had evidence that a parent was taking fentanyl and they didn't do everything they could to get the kid out of the house, how do you have accountability without being so harsh against these investigators that they quit? What does accountability look like here?
Accountability looks like using the tools that you have in your toolbox. So accountability is utilizing risk assessments to identify those most at risk, which when I said with neglect, fentanyl, the presence of fentanyl, based on what we know about its lethality and level of danger, fentanyl should have put these cases at the top of the pile. And so assessing safety must be a priority, the top priority. And this goes for all investigations, not just fentanyl. I also think you asked about accountability. A huge component of accountability is the courts, the use of the courts and that juvenile officer, a referral, and I don't believe that's being done.
One of the things I was talking about with Emily Van Schenkoff is just the lack of training about what to do when you encounter evidence of fentanyl. And one of the things that she specifically said is that since COVID, a lot of training has been online and not in person. That clearly needs to change, correct?
Yes, absolutely. Training is a key recommendation in almost every task force and every group that I've ever been a part of. When we look at improving our system, training is a recommendation. The move for trainings to be done virtually is problematic. I think that you can gain a lot from in-person trainings among your peers with those other parties also working in partnership. Juvenile officers, they can do training with Children's Division. I think you can't replace that with a virtual training. That collaboration, that engagement, and ability to ask questions and get answers.
Now, you mentioned tools in the toolbox. Are the right tools in the toolbox? Is there anything that needs to be added by the legislature or that can be done administratively that we haven't talked about?
And I'll reiterate that we have to use the ones we have properly.
Fair enough, but continue.
Okay. Yes, and there's some mention of that in the report. I think we have to continue working, but I think that there were solutions kicked around about if we're specifically talking about fentanyl, presence of fentanyl at the time of at the hospital when a newborn or referral notification to the juvenile office. That's an option. That's an option worth exploring, and I think discussing with lawmakers about that, and with juvenile office about what that would look like.
Now, the other thing that looms large over all of this is pay for these investigators. I don't mean to keep being a broken record about this, but the idea that we are going to get people to investigate some of the worst crimes against children and the starting salary is $43,000 a year, it's not going to happen. Mm-hmm. It is just not going to happen, especially when there are other jobs in the private sector that pay more and have a workload that's not unmanageable. But the legislature right now is only planning on boosting the starting salary by 3.2%. I've asked Governor Parson about this. He does not really want to go above that if the raises are not standardized. But how do we get the governor and the legislature to realize that the pay is a pressing problem that needs immediate action?
Well,
beyond doing the show, obviously.
We have to keep raising awareness. It's not unprecedented that the legislature has tried to push for increased pay for Children's Division workers. They've put it in the budget in the past, raised Children's Division. The House Budget Committee did it several years ago, and it was taken out, with the idea that, wait, before we raise one part of our state, let's look at the salaries of all state employees. And there's been a reluctance to explore the solution of specifically targeting increased pay for Children's Division. And it's problematic. We spoke earlier, we referenced it several times, just how important this job is, just how strapped they are. We talked about training. Training is heavy. I mean, that's a lot of on-the-job foundational and continuing training. That's a lot of work in addition to your daily responsibilities. Highly skilled. You have to be highly skilled in this. That's a lot to ask of an individual. That's a lot to ask of an individual with that level of pay.
And I guess I just have to ask this more generally, because this is something that I have been thinking about since I really started covering this issue last year with a lot of intentionality and a lot of energy. There are a lot of people like you who have been raising the alarm about Children's Division for years, and there are a dedicated group of bipartisan legislators who really want to tackle this complex and troubled agency. But it just does not seem that the vigor is shared by other policymakers in the executive and legislative branch. How can we get this to change? How do we get this to be on the front burner of Missouri policy and political discourse?
I think the show's a great start. I would say that covering a child welfare related topic on this show is not that. I mean, this is an excellent platform. I think that we've certainly had some great leaders and bipartisanship on these issues, and I think that we took a deep dive. This was at the request of the administration to have this subcommittee, making sure that this report and these recommendations the awareness is raised about them, about the issue, about the solutions, potential solutions. All of that must be continued. We can't let this sit on the shelf. We can't let a report sit on the shelf and not explore. And so I hope to have it in hand when I'm working with lawmakers next year. I mean, we're only a couple of weeks left here, but I hope to have it in hand. I've already started the discussion with some legislators, some advocates, kind of behind the scenes saying, what can we look at? Is this statutory? Is this not? But I think continuing to raise awareness that safety has to be a priority. Our current laws or practices are not going far enough. What can we do? What can we do? And that we've got to keep child welfare among the top.
Jessica Seitz is the executive director of the Missouri Network Against Child Abuse. She was one of many people who put together a report about child fentanyl deaths in Missouri. Jessica, thank you so much for joining with me today.
I appreciate you having me.
This episode was produced by Jason Rosenbaum.
Audio engineering and podcast design by Aaron Dorr.
Our executive producer is Alex Hoyer.
St. Louis on the Air is a production of St. Louis Public Radio. Understanding starts here.
Do you find yourself regularly listening to episodes of St. Louis on the Air? Suggest us to a friend you think might enjoy our conversations, and leave us a review and rating on Apple Podcasts on the App Store. It's the simplest way to help people discover our show. Thank you.
St. Louis Public Radio is a member-supported service of the University of Missouri St. Louis.
Support comes from the Missouri Forest Products Association, providing more than 41,000 jobs in the production of wood pallets, railroad ties, white oak barrels, hardwood floors, and more. Details at choosewood.com.